Hey Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 5 NCLEX questions. Without delay, let's get started.
Which of the following is an expected outcome for an adult client with well-controlled asthma? 1. Chest X-ray demonstrates minimal hyperinflation. 2. Temperature remains lower than 100 degrees Fahrenheit. 3. Arterial blood gas analysis demonstrates a decrease in PO2. 4. Breath sounds are clear. The correct answer is 4. Between attacks, breath sound should be clear on auscultation with good airflow present throughout lung fields. In which of the following maternal locations would the nurse place the ultrasound transducer of the external electronic fetal heart rate monitor if a fetus at 34 weeks gestation is in the left occipital anterior position? 1. Near the symphysis pubis. 2. 2 inches above the umbilicus. 3. Below the umbilicus on the left side. 4. At the level of the umbilicus. The correct answer is 3. As the uterus contracts, the abdominal wall rises and, when external monitoring is used, presses against the transducer. This movement is transmitted into an electrical current, which is then recorded with the fetus in the LOA position. The cardiotransducer should be placed below the umbilicus on the side where the fetal back is located and uterine displacement during contractions is greatest. The nurse should teach the client with asthma that which of the following is one of the most common precipitating factors of an acute asthma attack? 1. Occupational exposure to toxins. 2. Viral respiratory infections. 3. Exposure to cigarette smoke. 4. Exercising in cold temperatures. The correct answer is 2. The most common precipitator of asthma attacks is viral respiratory infection. Clients with asthma should avoid people who have the flu or a cold and should get yearly flu vaccinations. A multigravida client at 34 weeks gestation is being treated with indomethacin to halt preterm labor. If the client gives birth to a preterm infant, the nurse should notify the nursery personnel about this therapy because of the possibility for which of the following? 1. Pulmonary hypertension. 2. Respiratory distress syndrome. 3. Hyperbilirubinemia. 4. Cardiomyopathy. The correct answer is 1. Indomethacin has been successfully used to halt preterm labor. However, if the client should give birth to a preterm infant, the nurse would notify the nursery personnel about the tocolytic therapy because this drug can lead to premature closure of the fetal ductus arteriosus, resulting in pulmonary hypertension. Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? 1. Cough productive of yellow sputum. 2. Bilateral expiratory wheezing. 3. Chest tightness. 4. Respiratory rate of 30 breaths per minute. The correct answer is 1. A cough productive of yellow sputum is the most likely indicator of a respiratory infection.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.